Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to our first show of the year. It's 2018, and this is episode number 54 of the Better Health Guy blogcast series. Today's guest is Dr. Isaac Elias, and the topic of the show is Galectin-3 and Biofilms. Dr. Isaac Elias is an integrative medical doctor, licensed acupuncturist, researcher, product formulator, and frequent guest lecturer. He's been a pioneer in holistic medicine since the early 1980s and has published numerous peer-reviewed research papers on several of his key integrative health formulas. He is the founder and medical director of Amitabha Medical Clinic in Santa Rosa, California, an integrative health center specializing in cancer and chronic conditions. An expert in using highly strategic synergistic protocols to address numerous areas of health, including metastatic cancer, immunity, digestion, detoxification, diabetes, cardiovascular health, and more, Dr. Elias is also widely regarded as the leading expert in the field of modified citrus pectin research. Along with his clinical practice, Dr. Elias is an author and frequent lecturer who presents on his unique approaches to health and healing to practitioners worldwide. Dr. Elias is committed to empowering patients, practitioners, and those seeking guidance for lasting wellness through education, ongoing research, and community building. And now, my interview with Dr. Isaac Elias. It is an honor for me today to have Dr. Isaac Elias on our first show of the new year. Welcome to the show, Dr. Elias. It's a pleasure to have you here.
Thank you so much. It's an honor for me, actually, to start your year with the kind of work you're doing.
Thank you very much. So as we get into the discussion about Galectin-3 and about biofilms and tools that you have in your arsenal, I know that Lyme disease is certainly a topic that will likely come up. So how did Lyme become an interest of yours? Did you have a personal experience, either yourself or anyone in your family, that kind of drew you into this area of research?
That's an interesting and a good question, because my main focus is in the field of cancer and immunity and detoxification and chronic fatigue for many years. And I definitely have a very strong personal experience with Lyme and tick-borne diseases. I actually came to California in 1988. I don't know if I ever told you this. I came in 1988 to pick a school for Chinese medicine after I was an MD. And after picking the school in San Francisco, we went for one day to Lake County. And before we went back, I told my friends, I want to go and meditate in nature. So I sat and meditated for half an hour, and I must have gotten a tick bite. And by the time I landed in Israel, I had 40 fever, 104, severe symptoms, like stiff neck, and nobody knew about this kind of disease in Israel. But one of my mentors in my internship, a brilliant doctor, Yona Avni, she was an amazing internist, and in the ICU, they had a nurse from the hospital fighting for her life because of rickettsial disease. So they did a dark field on me, and they recognized the rickettsia. They gave me doxycycline for 2 weeks. Now, just so you get, my liver enzymes were between 5 and 10,000. I was like losing my liver. I did not respond to 2 weeks of doxy. So they gave me 2 weeks of a drug which is not legal to use anymore, chloramphenicol, because it suppresses the bone marrow, but it's a very powerful antibiotic. So I ended up getting antibiotics for 1 month. I finally responded, and I think that's what saved me from being a chronic. I think I got enough of intense antibiotics. But I must tell you, it took me probably close to 15 years to recover from some of the symptoms. Like my mood would change. I would feel this extreme thirst where I could drink 3-4 quarts of water. And over the years, with meditation, with lifestyle, it slowly improved and improved. And in addition, my whole family, both my wife and daughters, have had a very significant Lyme. So I naturally had to become an expert. We were successful in our healing journey for the family. And what happened is when I was talking, as part of the process, I really consulted with the best people in the country. And as I was talking to them, I realized that some of the most potent tools that people go to Europe or to other places to do are actually offered in my clinic. And because of my background of having a truly holistic approach, being a licensed acupuncturist, being highly trained in Tibetan Buddhism and meditation, and really studying medicine vertically, nutrition for years, acupuncture for years, herbal medicine for years, classical homeopathy for years, I started recognizing the underlying patterns beyond Lyme. And I think it's worthwhile to add to this discussion. I know that you subscribe to this. The Lyme is really just the agent. We really have to look at the terrain as the person. And what I noticed, and when I was treating chronic fatigue before I was aware of Lyme, or I accepted Lyme, I was helping everybody. But once I started identifying with Lyme as a problem, my results were not as good anymore. So there is a very deep mental, psychological, energetic component that has to be integrated into the biomedical, physiological. And it's a lot of how I do medicine, and it's how I'm trying to address Lyme disease.
Yeah, that makes tremendous sense to me. I know personally, I never took on the term limey. I never wanted it to become me or me to identify with it. And I do think that that's important. I think the more we identify with our condition, the more difficult it often is to recover from it. So I think that's a very interesting observation. Let's talk a little bit about Galectin-3. You're the Galectin-3 guy. And so I'm interested in, what is the role of Galectin-3 in chronic illnesses where there are underlying infections, and what is it that Galectin-3 is intended to do, and then what are some of the problems that it potentially does when it kind of gets out of control?
So Galectin is a carbohydrate binding protein. It's part of the lectin family that were discovered by Dr. Avram Raz in the late 80s, which now we do a lot of research together and we collaborate. And so it binds to different carbohydrates. It binds to glycoprotein. It binds to glycolipids. And the role of Galectin-3 is very different inside the cell, where it's used for embryogenesis, for differentiation, and on the membrane and the interstitium and the circulation, where it's used more for injury repair. So the main role of Galectin-3 is injury repair. So even in infection, it has an important positive role, but only in the first 60 to 90 minutes. Literally, it's so short, After 60 to 90 minutes, it starts having its negative effects. So why? Because the mechanism of the injury repair drives inflammation and fibrosis. So if you look at the chart, if we can visualize, and I can send you some charts if you want to add, if we look at the inflammatory fibrotic pathway, Galectin-3 is in the middle. It's really the conductor of the orchestra. And then it will drive the inflammatory pathway through interleukin-6, interleukin-8, different cytokines. It will drive the fibrotic pathway through stimulation of fibroblasts, through stimulation of TGF-beta, and different connective tissue mediator, then end up causing fibrosis. So as a result, Galectin-3 is a major upstream driver, means it begins the process of starting this process in almost every chronic disease. So for example, if we look at infections, we can look at Lyme, but we can look at something like sepsis, okay? If you look at sepsis, people who die from sepsis die from the cytokine storm. They die from the extreme inflammation. The body has to know that there is such a problem and produce the excessive inflammation. Galectin-3 serves as something called an alarmin it alarms the system and it starts the cycle. So in sepsis, it will already go up after 2 hours, while the cytokine will go up only after 18 hours. So if you can block the Galectin-3 storm, you can prevent, for example, these infections from getting worse, even in acute setting. It's much more critical, of course, in the chronic setting, in the Lyme disease, and that's why we have a lot of time, to talk about it today.
So Galectin-3 then leads to inflammation, and in people with Lyme, even though they may have these infections, many of the symptoms that they identify as being Lyme are actually the result of this inflammation that's really not a normal, healthy inflammation, correct?
Absolutely.
Okay. So what is the connection then between Galectin-3 and biofilm formation when people have chronic infections? Does Galectin-3 also allow these pathogens to somehow hide within the body and avoid the various treatments that people are using to try to eliminate them?
Absolutely. No, I think that the biofilm is becoming more and more of a popular concept. And we know, for example, from the connection of phospholipids or heavy metals, okay? So let's if we look at the oxidized fats, the best fats that are oxidized and then can bind to heavy metals. These are glycolipids. So you got all these components that we are chasing, but all of them are sitting on Galectin-3. Why? And I'll try to make the image with my hand. It's a little bit tough. Let me see if I can get it in here. Here it is. So this part is the amino acid part, and this part is where the carbohydrate get bound to Galectin-3. And then they create a pentamer with 5 of them, and then they create a lattice formation. So the backbone, the basic structure of the biofilm is Galectin-3. And on this structure, you have the oxidized phospholipid, the glycoprotein, the heavy metals, all of them allowing one to cover and help the different pathogens to hide, and to help the pathogen to evade the immune system. For example, if you take T cells and you put Galectin-3 in the medium, you will get complete suppression of cytokine excretion. The immune system stops working. If you introduce a Galectin-3 blocker into the medium, the cells will start excreting cytokines again. That's how powerful Galectin-3 is in immune evasion. And that's why, for example, when we did some of our studies on modified citrus pectin and immune response, we checked modified citrus pectin and we checked different medicinal mushrooms, but there was no point to publish on medicinal mushrooms. The modified citrus pectin, to our surprise, was so much more powerful. Now, this was about 12 years ago. Now we know the mechanism, So, yes.
So it's supporting the immune system, but it's not necessarily boosting the immune system in a way that some interventions could do that leads to more inflammation.
No, definitely. It will regulate the inflammation, definitely. That's the uniqueness. It's not, let's like, you talk a lot about cytokine. Let's take a look at Tnf Alpha, okay? Tnf Alpha, it's a double-edged sword. It produces inflammation, but it also kills infection and cancer. So on a short term, TNF alpha is very important. On a long term, it will cause inflammation and damage, and it's a very bad thing. Galectin-3 doesn't have this. Galectin-3 when you block Galectin-3, you are lowering inflammation and you are enhancing the immune system. That's what's so unique about it. And that's why something like modified citrus pectin is very unique. If you look at animal trials and clinical trials and in vitro studies, so usually we have many compounds, drug, non-drug, that are very promising, right? In vitro studies, in animal studies. Then you come to the human realm and they don't work. With modified citrus pectin, it's the other way around. It works best in human clinical trials because when you do it in vitro, you can't express its multifaceted benefits because it's really the conductor, and it has so many effects that you can only see in a complex system like the human body. Very unusual.
So is there a connection then between Galectin-3 and hypercoagulation or thickening of the blood in people with chronic infections? Is there
Definitely. Absolutely. Absolutely. Because of the glycolipids, because of the heavy metals, because of the atherosclerotic plaque. It's much more extreme than this. I mean, it's interesting. I want to point out, if you look at, Lyme is a very elusive disease from the point of view that it has so many symptoms, right? You can't really lock yourself. It has very different treatments. And I think some of them are very intuitive. You can't say that every treatment in Lyme or tick-borne disease has a lot of research. Galectin-3 has about 5,000 published papers. 5,000, okay? About 1 to 2 papers a day. Just our Modified Citrus Pectin is already over 40 published papers. So it's very interesting. While the initial interest in Galectin-3 was in the field of cancer, it shifted into inflammation and fibrosis and now into infection. And as a result, the NIH developed a lot of interest in the field. So for example, if you look at patients with congestive heart failure, which obviously usually will have hyperviscosity, if regardless of what category they are in, it's a large study, 582 people, if their Galectin-3 is under 17.8, 12.5% will die in 1 year, which is significant. If their Galectin-3 is over 25.6, not a huge difference, 37% will die in 1 year.
Wow.
All of them will be dead in 3 years. Why? Because the lattice formation, the fibrotic effect, Galectin-3 is what will turn hyperviscosity into fibrosis. And when you have fibrosis, you have degeneration, you have death. That's why it's so important.
So can you talk to us about how reducing Galectin-3 may support the other treatments that someone may be doing in terms of making them more efficient and more effective? And then how does reducing Galectin-3 help to expose, bind, and remove infection from the body?
Yes. So the answer, first I'll give the short answer and then I'll elaborate.
Okay.
So the short answer is, regardless of what treatment you are doing for Lyme disease, regardless, if you add modified citrus pectin, you will get better results. And now there are a few leading tick-borne disease Lyme doctors who have started doing it, and now all their patients are on Pectosol C modified citrus pectin. Because if they subscribe to antibiotics, if they subscribe to non-antibiotics, if they need to do detox, if they need to enhance the immune system, if they need to chelate heavy metals, and it's all in one substance that is so safe. I mean, in many levels, I really feel about modified citrus pectin is a gift from nature. You can't get much more natural than extracting a pectin in a unique way, in a unique proprietary way, which I want to emphasize, from the peel, from the inner peel of a citrus fruit. And then you got all this crazy science going on,
So that's, I think, important too. So when people see products that just say citrus pectin or apple pectin or whatever pectin, that's not the same as your citrus pectin because there's a process that it goes through. Maybe you can talk about that just a little bit.
Yes. So pectin in general is a long chain of galacturonic acid, of a carbohydrate. And usually it's esterified. It has a methyl group. And it's a very high molecular weight, so it can't get absorbed. It has to be modified to a low molecular weight, 3 to 13 kilodalton. The esterification has to go down dramatically, but you have to preserve the side chain with a neutral sugars that gives the immune enhancing effect that binds to heavy metals. So all the discoveries, like all the significant patents, all the clinical trials, all the published papers, the only commercially available MCP used is Pectosol modified citrus pectin. It's important for me to emphasize because of the concept of borrowed science. I'm about to present a result on substantial size study, our third study in recurrent prostate cancer in 3 weeks in American Society of Chemical Oncology GU annual conference in San Francisco, okay? Now, this is the results of 22 years of research. Okay. Now, of course, once it becomes popular, then anybody can put, because every pectin has to be extracted, it has to be modified from the peel. Anybody can call something modified citrus pectin. But really, all the research, all the work, all the discoveries are done on pectosol modified citrus pectin. And it's much bigger than me. Now there are multiple large institutes doing studies unrelated to me, or I'm just giving them the material. We have 2 double-blind studies ending with Harvard MGH. I mean, 2 double-blind clinical trials. One of them NIH-sponsored. I mean, this clinical trial on cancer on close to 40 patients is the 3rd clinical trial. We have studies with MD Anderson. We are studying, we're working with close to 20 different leading research institutes, which is really, which is exciting.
So how do we measure Galectin-3? You talked earlier in the show that there were certain risk factors associated with different levels of Galectin-3. Is it something that should be or can be measured in Lyme disease? And is it possible to accurately measure in those with Lyme disease?
So it is quite easy to check Galectin-3 levels. It's an ELISA-based test. It's performed by every major lab, and it's covered by every insurance. It is formally approved for a cardiovascular risk, but any doctor can write it for any reason, and usually it's covered, even Medicare pays for it. So why is it important to really check the levels of Galectin-3? It is important because for some people, they may be in quote-unquote good health, and they check their Galectin-3 level and they find that it's very high, or it's higher than expected. So in the population, in healthy population, Galectin-3 level is around 9, 10 average. It goes up with age. Very interesting. As we age, Galectin-3 levels goes higher. One very interesting study on centenarians, people who are over 100, the average age was 104. They did their average Galectin-3 levels and compared to healthy individuals 70 to 80 years old. You have to remember, the 70, 80 years old people contain within them a few lucky ones that will get to 104, right? The levels in the people who are 70, 80 was much higher than the one at 104. So Galectin-3 is an aging factor, and blocking it is an anti-aging treatment. So within it, the important thing for checking Galectin-3 levels is to really determine how much modified citrus pectin you need to take. If you are healthy and your Galectin-3 level is under 14, 15, 5 grams is enough. If Galectin-3 is higher, you need more modified citrus pectin because simply you have to address more Galectin-3. But if your Galectin-3 is low, you will still benefit from modified citrus pectin. We see it in our cancer patients. In the study I'm presenting, it didn't matter where was the Galectin-3 level, they still benefited. We had 80% benefit. So
and
now I want...
So is 9 to 10 your target then for Galectin-3? Or if someone's using modified citrus pectin, do you like to see it even lower than that?
So modified citrus pectin will not necessarily lower Galectin-3. It will lower Galectin-3 just if we are able to reduce the inflammation significantly enough. But what it will do, if we go back to this image, instead of having a nasty glycolipids or glycoprotein or things like fibronectin, integrin, many of the sticky molecules, inflammatory molecules that we have, VEGF, they sit right here. They get right here. When the modified citrus pectin goes in, it displaces these molecules and the lattice formation breaks down. The pentamer, once a single Galectin-3 binds to one of these nasty molecules, it will fold on itself and create a pentamer with 5 Galectin-3. And that's how the lattice formation will be created. Once you take them out, the lattice formation will break down. That's why we see the results in immune evasion, in cancer, in inflammation. So in this sense, eventually, yes, the Galectin-3 will go down. But for some people who have a genetic predisposition, let's say, or certain scars in the body that are trying to repair themselves all the time, they keep on producing Galectin-3. Our job is to prevent this Galectin-3 from creating nasty things by blocking it. And that's what Modified Citrus Pectin will do. Now, in Lyme, it's a little bit different.
Yeah, that's what I was going to ask next is, do you find a correlation between the levels of Galectin-3 in someone with Lyme and the severity of their symptom presentation?
Yes, but very different. I find that most Lyme patients have low levels of Galectin-3 in the circulation. The reason is that the Galectin-3 is sequestered in the biofilm. Because if you look at C-reactive protein in Lyme patient, it's low, right? But yet they have inflammatory symptoms. If you look at the TGF-beta, it skyrockets, right? When you start giving them modified citrus pectin, Galectin-3 will normalize from 4 or 5 or 6, extremely low, to 8 or 9. Their ability to repair is getting better, and the TGF-beta will drop to normal levels. They are now able to mount a normal inflammatory response instead of a dysfunctional fibrotic response. And we see this across the board.
So now I think we have kind of the basic understanding that Galectin-3 is really at the center of this inflammation or inflammatory process in chronic Lyme and other chronic illnesses. So talk to us a little about modified citrus pectin is one of the tools we can use to reduce it. Are there other things that you also use in your arsenal that affect Galectin-3 and healthy inflammation, or is modified citrus pectin the primary tool here?
In general, any strategy that reduce inflammation can eventually help Galectin-3, but addressing Galectin-3 will make all strategies work better. So modified citrus pectin, Pectosol modified citrus pectin is really the only proven commercially available Galectin-3 blocker.
Okay.
And go ahead, Scott. You wanted to?
Yeah, I was just going to ask then, in terms of people think of Pectosol or modified citrus pectin as being a binder. And usually when they say binder, they're thinking about heavy metals and other related toxins. And so how does modified citrus pectin compare in terms of its metal binding properties? And does that then help to reduce biofilms in the body as well? What is it about MCP that's also reducing the biofilms?
So again, the first primary function of modified citrus pectin is that the moment it binds to the Galectin-3, it breaks down the whole structure of the biofilm, bigger than removal of any heavy metal. And that's why it's so fundamental. But when we look at its heavy metal role, modified citrus pectin is one of the most powerful chelators of heavy metals. I don't know if there are any other chelators, definitely natural, that are especially for lead. It's an unbelievable binder to lead, extremely powerful. We have published one paper on children in China with toxic levels of lead that were given modified citrus pectin. It was 7 children, it was supposed to be more, but because of the politics in 2007 with the lead-tainted toys, the Chinese stopped the study. It was an independent study. And all 7 children were hospitalized with high levels of lead, about 30 microgram ml or 50 even. All of them had dramatic decrease in the blood and dramatic increase in the urine. Dramatic. So really almost unparalleled. The problem with heavy metal, especially with lead, is that it hides in the bones. So we know that MCP, modified citrus pectin, is a great chelator of heavy metals, but you have to use it over a long-term period with the hope that with the gradient changes, slowly, it will deplete the tissue. We have shown that it can do it with mercury, but with lead specifically, it's tough because some people can have, especially women with the osteoporosis or anemia, the bone can literally be full of lead. And sometimes it takes years and years and years to clean them.
So would you say then that it is a fairly effective binder of mercury and aluminum as well as lead, or how does it?
Absolutely.
Okay.
It's of how did I get the idea of using it? Because after the Chernobyl incidents, children were given regular pectins because the food was containing radioactive, positively charged material like uranium and cesium. Especially looked at uranium. They saw a 60% reduction in the radioactive readings when children took these pectates, which, interesting enough, was pulled out of the literature afterwards. But now it's you can find it again. So that's when I came with the idea, if I modify it and it gets absorbed into the bloodstream, I will have a systemic chelator of heavy metals. And we have shown, we've done a study with the USDA, NIH sponsored with USDA, showing that when you use our modified citrus pectin, you increase excretion of whole heavy metals in the urine, but you do not increase the excretion of essential minerals.
So I know in one of your detox products that has modified citrus pectin, there's also the alginate that's combined with it as well. And I think that led some people to think that, well, as a binder for metals, maybe it didn't stand alone as well as that combination. So what's the reason that the alginate is put in with the modified citrus pectin?
Well, that's an excellent question. And the feedback like this actually helps me to understand how to position it from explaining to people. When you add an alginate, you extend the profile of the chelation, because it's another polyuranide. Polyuranide work by the same mechanism. They are negatively charged and they bind to positively charged heavy metals. So in this sense, when you add it, you get a larger profile. The other things, both modified citrus pectin and alginates can bind to mold toxins, to neurotoxins, to different toxins from the environment. They're really swamp cleaners. So when you combine them, you get a better profile. But most important, the alginates can prevent the reabsorption in the gut.
So that was my next question, actually, was if modified citrus pectin had some ability to bind environmental mold toxins and help those people that are exposed to or living in water damaged buildings. It sounds like the answer is yes.
Definitely.
It sounds like you were suggesting that in that scenario, the product that combines the citrus pectin or modified citrus pectin with the alginate might be even more effective because it will also help to minimize reabsorption of those mold toxins in the colon. Did I understand that correctly?
Yeah. So what I will do usually, and again, as the data on modified citrus pectin becomes so overwhelming, I personally more and more move people to just using the modified citrus pectin because I want to make sure that they have enough. But if you know that there is a significant concern about heavy metals, or they are or they are going through a detox process, then let's say if I want to give them modified citrus pectin 5 grams twice a day, okay? Then I may give them 7.5 grams or 5-6 grams of modified citrus pectin, and I will give them another 5 grams as the modified citrus pectin alginate combinations. So this way I still have, because I want to make sure I have enough modified citrus pectin to deal with the Galectin-3. And it's really interesting, when we started doing our work with Galectin-3, with modified citrus pectin, and interesting with modified citrus pectin alginate combination, the product was really, the company was distributing it to a large number of people. We're talking 2001, 2002. They started getting letters that people's joint pains and people's memory and the mental function are improving. Now, nobody had any idea about it. I had an idea that there is involvement with inflammation in 1999, and I kind of discovered it, but it took many more years to have any substantiation. But yet the feedback was something is affecting the joint, something is affecting mental function. And now we understand that the role of Galectin-3 is so critical. In Alzheimer's plaques, there is 10 times the density of Galectin-3 compared to brain tissue without Alzheimer. There are very fascinating studies that are so relevant for Lyme. If you look at neuroinflammation, if you inject a nerve irritant into the spine of animals, okay, and you look at the increase in inflammatory compounds, and if you give them modified citrus pectin, it will mitigate and improve and cancel the negative effect of the irritant. So modified citrus pectin is a great neuroinflammatory protection value, and which is so important for Lyme patients, is we know when we look at the processing in our body, we have the mental processing and we have the digestive processing. So in Chinese medicine, the mental function, the ability to store memory, was always related to the digestion for centuries. Now we know that many neurotransmitters are produced in the gut, right? And so many times when you will give patients modified citrus pectin, Lyme patients, they will tell you, it's the one thing that makes me actually feel better right away. Like I know in my own family, inflammation goes right away. Nausea goes down right away. Clarity gets better right away. Because we are addressing this neuroinflammation, chronic inflammation, the lattice formation, the hyperviscosity. And it's really because of this Galectin-3 being the conductor. I must say, I've never had a clue that this is what it's going to do. It's interesting to look at my personal story with modified citrus pectin. I'm a native of Israel, which used to be very famous in its citrus industry. Nobody knows anymore. Now it's high-tech and weapons and cybersecurity. Most of Israel used to be citrus orchards. And my neighbors were pioneers in the citrus industry. They were PhDs in organic chemistry. In 1971, I was 12 years old. We went to our neighbor, Dr. Ruth Cohen, and out of the blue, she turns to me and tells me, Isaac, one day they will find the treatment for cancer from the peel of the citrus fruit. Somehow, this kid, it stuck in my mind, 24 years later, when the first paper by Dr. Raz that we collaborate with came out, I called her up from San Francisco. I told her, Ruth, it's Isaac. I don't expect you to remember, but I remember what you told me. I need your help. And she put me together with the pectin scientists. And it's interesting that now recently, we were able to develop an antibody and demonstrate that our modified citrus pectin, the pectosol C, get absorbed into the bloodstream. It has a half-life of about 10 to 12 hours, longer than we thought. So there is a bioaccumulation of MCP. There's a long-term effect. One of the issues with many of the natural substances is that their half-life is half an hour or an hour. With the MCP, when you take it twice a day, so twice is probably enough. 3 may be better, but twice will do it. You will get an ongoing coverage, which is probably one of the big merits of using modified citrus pectin.
So that was actually my next question. So that was perfect. So we know now that it does get absorbed systemically and into systemic circulation. And so when it's absorbed, let's say that there are some metals that are bound to modified citrus pectin. How do those then leave the body? Is it through the liver, gallbladder, colon, or is it through kidneys and urine? What's the route of elimination from these toxins that are bound to the pectin?
No. There are no perfect answers. We know that elimination increases in the urine. We have demonstrated it multiple times. But it doesn't mean that there is that none of it goes out in the bile or through the stool. I assume that some does, but we know that a lot gets eliminated through the urine. This is for a fact.
So we know that in Lyme, it's not so much about the organism or organisms, but it's about the terrain. So would we say that it's reasonable to say that modified citrus pectin improves our overall terrain, which then makes us less hospitable to these microbial overgrowths? Is that a reasonable way to look at it?
Definitely. It does this, and it makes us more responsive to any therapy. Because imagine that you use an herbal combination, homeopathic, or you use the antibiotic for the ones who use this, If there is a lattice formation around the infectious area, you can throw as many things as you want against it. It won't work. You can see there are multiple studies showing that Galectin-3 helps parasite, fungus, bacteria, viruses evade the immune system. It's a universal mechanism, you know? So it's really, you have something that kind of like exposes the microorganism, whatever it is, okay, and makes the body respond better to it, and reduces the accompanying inflammatory process and fibrotic process that causes damage. So you can see how naturally what you will get if you talk to some of the Lyme doctors who are using it like in large number, they will say, look, whatever I was doing before is simply working better and faster.
So it's potentially helping the body to reduce heavy metals. It's helping to minimize biofilms. It's potentially helping to support the immune system. It's also helping to shift the inflammatory response to a more healthy inflammatory response. So it's amazing that it does so many different things. It's not just a binder, but there's many reasons why it might make sense in someone with Lyme disease, for example.
Exactly. And what's interesting, I think there's one study with cephalosporin, or maybe another cephalosporin, showing a dramatic increase of effectiveness when you combine it with modified citrus pectin.
Wow. Let's talk a little bit about, you mentioned TGF-beta1. I think many people listening are familiar with that from the realm of Dr. Richie Shoemaker's work in water damage building illness and mold illness. There's also C4A, MMP9, these measures of inflammation in biotoxin illness. So do we know which of those modified citrus pectin potentially will help to reduce? Is it primarily TGF-beta1? Have we looked at C4A and MMP9, for example?
You know, it definitely reduced TGF-beta. It will definitely reduce all the different inflammatory interleukins. And as a result, it should introduce C4A as well. And it will probably affect MMP9. MMP9 is very interesting because the metalloproteinases, which are elevated in certain people genetically, can cause a pentamer of galectin to break down to monomers. And these monomers are much smaller in size, right? So they can now reach different target tissues, penetrate into them, bind to an inflammatory compound there, and create pentamers. And that's why, for example, in cancer, the people with high level of MMPs are the one where they will actually metastasize, where the Galectin-3 will cause metastasis, and where you need to use modified citrus pectin. So the answer is yes. Because you are getting a normal repair of the tissue, all these abnormal compounds will be downregulated. And TGF-beta is probably the most dramatic one.
Yeah, it would be interesting to see in people who have elevations of all three of those that are water damage building or Lyme type patients. It would be interesting to do a study to see if all three of those reduce in those patients with modified citrus pectin. It sounds like
I'm almost sure that the research is out there. I'll just have to check it and I'll send it to you. Okay. But this is why when somebody will take, for example, the Pectisol C, we have a version with stevia. So it's sweetened, and there's some work with stevia, with potentially with the biofilm, so it works well. People will drink it and they will tell you, my head is clear. Like sometimes almost instantaneously, you know? And there are no sugars, there's no stimulant, it's a fiber. Because I think it's having this almost immediate effect on reducing this inflammatory-driven process and removing the mycotoxin. It's kind of mind-blowing how safe it is and how effective it is. You know, I'm presenting the data now, again, on significant amount of patients in a few weeks for cancer. Not one of them had a significant side effect. And these are people with cancer, you know.
So that's a good question, though. In people with Lyme, if you start breaking down these biofilms, many other things then would lead to Herxheimer reactions and an exacerbation of symptoms because the immune system is now seeing these microbes that were kind of hidden away. So is it common to see an intensification or Herxheimer response when you incorporate modified citrus pectin?
No, that's what's so amazing. The other way around. Because remember, whatever is breaking is also binding to the heavy metals, binding to the glycolipids, binding to the glycoprotein and clearing them. That's what's so amazing. That's when I remember I told about Tnf Alpha when we talked. Mm-hmm. It's a double-edged sword. If you block the Galectin-3, if you use modified citrus pectin, you are benefiting by both increasing, enhancing, improving the immune response, the ability to kill, if you want, the infectious agent, and you are reducing the inflammation that is causing the side effects. So even people with very sensitive gut will tell you, it feels good to me. The only thing, some people will get some more flatulence, a little bit of bloating, but not because of the pectin, because it's very acidic it's buffered by potassium and sodium. And sometimes the electrolytes will create a temporary reaction in the gut until you get used to it. It's not from the pectin.
So people are commonly allergic to citrus fruits. So the question comes up then, are people also then potentially allergic to modified citrus pectin, or does that not seem to be a common issue?
It's not an issue because it's just really a chain of carbohydrates from the peel. So all this idea, for example, that people who cannot drink grapefruit juice because of the cytochrome P450, people who are allergic, potentially, I had one case of an allergic reaction in these 22 years. Maybe, let's say, on hundreds of thousands of people. I've never seen a clear allergic reaction to MCT.
So you mentioned 5 grams twice a day earlier. Is that kind of the general range that someone with Lyme would incorporate modified citrus pectin into their daily routine?
Yes. So for somebody with Lyme, 5 grams twice a day is a very good place. In the beginning, if they think that they are very toxic, they can do 7.5 grams, which used to be the traditional dose. We're now finding out that lower doses work. And once they feel better, they can stay with 5 grams or 7.5 grams once a day.
Very good.
With a longer half-life, you can now do it.
Can you add MCP into a smoothie? And the reason that I ask is a lot of times people have highly nutritional substances. Some people put trace minerals into their smoothie and so on. So is there the possibility, if you're just putting it into your smoothie, that you're then binding some of those other nutrients and making it less effective? Or is that a reasonable thing to do?
Usually it's not a problem to actually add it to your smoothies. And if it does bind to trace mineral, it will just, as it gets absorbed, it will just help them to actually get into the system. So it's not an issue.
So are there any people that are potentially not good candidates for using this? Can it be used in people that are pregnant, breastfeeding, or no?
It can probably be used I don't give it in pregnancy and breastfeeding because you don't want, in the embryogenesis, you don't want to affect the Galectin-3 metabolism. So I stay away from, although it's probably good because it reduces inflammation. So that's one category. The only other condition where you have to be careful about the amount is with people with significant kidney failure, where the levels of potassium are too high and they can't handle any potassium because it's buffered with potassium and sodium at a ratio of 4:1 potassium to sodium, because I try to mimic what you have in fruits, in vegetables, in nature. So if somebody has truly kidney failure, not just a little bit, where they have an issue where they are on potassium-restricted diets, then they have to be careful about modified citrus pectin. They may use, if they really need it, they may use only 2.5 grams a day.
So
And
talking about the kidneys, if the urinary excretion of metals increases with modified citrus pectin, then those metals are moving through the kidneys. So is there a need, or would it be smart to increase the focus on kidney support when you're really moving these metals through? Or is it not a kidney stress because it's bound to the modified citrus pectin?
it's usually not a kidney stress, but it's always good, just like you said, to support elimination.
Okay, very good.
And excretion, definitely.
So you have a number of products. We've really talked about the modified citrus pectin. There's one other one that I wanted to touch on in this conversation relative to people that are dealing with Lyme disease and chronic infections, and that is the Honokiol. So let's talk a little bit about Honokiol. What is it? Where does it come from? And then what are some of the properties that it has that could be helpful in people dealing with Lyme and similar conditions?
So Honokiol is a biphenol from the magnolia tree bark. And it's a remarkable compound. It's remarkable because it can adjust its benefit based on the function of the cell. What do I mean? If you look at a normal cell, in a normal cell, Honokiol is an antioxidant. But in cancer cells, the P53, which is a regulatory gene, expression gene that regulates the cell and prevents it from becoming cancerous, when the P53 is too low, the cancer's metabolism shifts. And then the cell metabolism shifts, and then what happens, Scott, is the cell is no longer using its mitochondria. It's what you call aerobic glycolysis, the Warburg effect. Important because Lyme patients have something similar. They have mitochondrial dysfunction, okay? In these patients, Honokiol becomes a pro-oxidant and helps, for example, to attack cancer. So that's one unique thing about it. But the other part that I know that when I lectured at Eliaz, I think Bob Miller, Dr. Miller was after me, and he actually, interesting enough, he was talking about Honokiol and the connection between the glutamate GABA and the mTOR1. So Honokiol is a powerful mTOR1 inhibitor, but also inhibits a lot of other pathways. It's an hypoxic-inducing factor inhibitor. So when there's abnormal cell, if you look at the biofilm, if you look at hyperviscosity, if you look at areas where there is not good oxygen coming into the tissue, very common in Lyme, there is hypoxia. When there is hypoxia, you get abnormal metabolism. You have to move to anaerobic metabolism, to glycolysis. You get muscle pains. You get inflammation, which is really metabolically driven. Okay? And we know now he's seeing connection between this thing and Lyme disease. So one of the things that Honokiol does very powerfully, it reduces glutamate and converts it into GABA. So it has an amazing relaxing effect. I mean, if you take it, you feel your whole being relaxes. It's a very interesting experience. But different than CBD or THC, it doesn't get you stoned.
So for people that have high levels of anxiety then, which is fairly common in people with Lyme, would this potentially help support their anxiety?
Incredible. Okay. So for these people, they will take one Honokiol with breakfast and one Honokiol with dinner. One of the Honopure that has 250 milligrams. And they can take, if they need for sleep, one more before bedtime.
So one of the things that I read about it was that it also has some antimicrobial properties. And so do we know what kinds of microbes it may help the body deal with? And then does it have a role in terms of Lyme and Lyme-related co-infections, or not so specifically?
It's really, when you look at the literature, it's amazing. It literally has an antimicrobial effect against almost everything, from dengue fever to HIV, to different viruses, to different to periodontal infections, to fungus, very strong antifungal effect. So it has a very broad anti-infectious effect, and some of it is because some of these agents don't have the same mitochondrial functions that we have. So for this agent, it becomes a pro-oxidant and it attacks and kills them. And that's, I think, where Bob Miller was finding it from a metabolic genetic point of view, and we are seeing it. It's where you have an abnormal function, Honokiol clears up all of these infections. So it has a very wide profile of anti-infectious qualities. It's a powerful anti-inflammatory, but it has remarkable neuroprotective effects. It really, the patient who take it will tell you the concentration is better and they feel more relaxed. Things are clearer for them.
So I know I can't have you on the show without asking for your perspective in general in people dealing with Lyme disease. What are some of the primary antimicrobial compounds that you think about when you're treating somebody with Lyme disease?
That's a big question. So I think we have to first divide it from the school of using antibiotics to the school of not using antibiotics. And some of it, for people who are medical doctors, also has a medical legal issues, of course. So when somebody has an acute infection, I do think that there is a role to antibiotic therapy. But I must tell you that and a lot of it is my responsibility, and what if I'm making a mistake? And I did it with one of my family members when they had a severe acute infection. Now, one of the most severe that one of the most experienced doctors in the Lyme field have seen in 35 years. And they got a full, wider range of antibiotics, oral and IV, and it didn't work. After months, they were so sick, and now they're okay without any antibiotics. Okay, so I do think that even in the acute setting, for example, Christine Gedrick, which I have so much respect for, she's brilliant, she doesn't use any antibiotics in acute cases. She says one case, one dose of doxy, 200 milligram, and then she uses a high dose of herbal tinctures. And according to her, and again, I really respect her, she's never had one person that developed Lyme. But for me, it's a little bit scary, But I think that I'm going to shift from now on for people with acute, and I don't see a lot of them, to starting them on antibiotics. If they tolerate it, great. And some people tolerate antibiotic, great, then it's fine. But if not, that after a week or so, just shift them into herbals at high dose. And but I think more research is needed. In the Lyme, there are so many Lyme patients, and the research is not there. And it's not my main field of research. So I tell my colleagues many times, we can't make assumptions. We have to do the research. And what we did with Modified Citrus Pectin is an example of what needs to be done. On a long-term basis, I really think that we really have to recognize that we have the ability to overcome infections. We do, Otherwise, we all would be dead. We just have to be very smart about it. And we have to recognize that there is an ongoing dialogue between us and the infections. What's so unique about tick-borne disease, which is a reflection of the weakening of the earth and the abuse of the environment, is that it reflects our relationship with the environment. It's not a regular infection that comes into our body. It has to use a vector. It involved another sentient living being who carried it, who gave it to us. There is a relationship between us and the environment. So in this sense, supporting the terrain is usually, in many cases, enough. And then you have to attack. So there are multiple herbal formulas that are very important that I use a lot, from different, Japanese knotwood, Chinese herbs. There are many, many different herbs. I've been working now for about 2 years, and I'm just about to start testing with some leading Lyme doctors. I've taken very powerful herbal formulas but a little bit in the same dialogue like our relationship with the environment. I've used these herbs and I fed them as a feeding basis for medicinal mushrooms. And I was able to grow the mushrooms on 80% herbal formula, literally 80%, not like 1 or 2%. And naturally what it will potentiate the herbs, it's what mushroom does, but it also will give the immune enhancing effects. So I'm very excited. I've gotten a few preliminary, very encouraging results, and I'll fill you in. I'll send you some.
Yeah, fantastic. So let's kind of move then to questions about stress and the importance of meditation and so on. So how important is stress reduction and tools like meditation when you're trying to shift the body out of this sympathetic overdrive state and fighting a chronic infection? How important are stress reduction and meditation?
I mean, stress reduction and meditation are essential. But and if you ask me, Isaac, what is your greatest expertise in your life, in your 58 years of life, I would say meditation and healing without hesitation, because that's my life path. I started meditating when I was 15. From 1989, 1990, for 20 years, every year, I would spend 2 months away on meditation, and for 10 years, I spent half day meditating, half day working. I took 2 years off to meditate, and now I'm putting it together into meditation and healing, which I always do on a volunteer basis wherever I'm needed. So I can speak as somebody who actually not only reads about it, but does it every day, I mean, I did my 2 hours of meditation this morning. So it has an enormous effect on reducing stress, but it has a much greater effect in Lyme, because this sympathetic system being on is part of the reactivity that is caused in the Lyme patient, which you can say, you can relate it biochemically to high glutamate levels. That's why Honokiol, for example, is so useful, right? When you have more inhibitory neurotransmitters, you don't react as fast. You're less reactive. But why is this so important? Because it's about our reactivity with the environment, with the pathogens. It's about us feeling tired and saying, oh my God, it's Lyme. And then, if it's this, I'm going to get this, and I'm going to get this. And without knowing it, it creates a chain of events, neurotransmitters are changed, chemicals are changed, and we get a flare-up. So meditation allows us to create better boundaries and better acceptance. We can have one day when we feel good and one day when we don't feel good, and then we can feel good the next day or the next week. Or the week we don't feel good can be the end of the world for us. Well, it's part of it is a sympathetic system being on. And meditation really changes it, and within meditation, there are very specific techniques that specifically relate to meditation and healing. I have many students in this field, and people have asked me to write a book about it for probably 20 years. I'm finally starting to write, actually going to be in Hebrew first, just because I taught so much in Hebrew that it's all ready for somebody to actually just write it down. But meditation is a powerful part of addressing Lyme disease. Very important.
So a slightly different way of phrasing this question, talk to us a little about the impact of mental, emotional, spiritual realms and how those not only impact our propensity to acquire or develop illness, but how we might need to focus on these realms in order to recover from a chronic illness as well.
Yeah, so I think it relates to what I was mentioning, because when I talk about meditation and healing, I naturally talk about the physical, the emotional psychological, the psycho-spiritual, and the spiritual. For example, in Buddhism, we talk about body, speech, and mind. Body is a medicine. Speech is an expression. Breathing, sound, energy, prayer, movement. And mind is really how we perceive reality. If we recognize that everything is changeable, because everything is changeable, it doesn't matter if we recognize it or not. Everything, you and I are different now than we were when we started this discussion. and we're going to be different when we end it. If we recognize it, we recognize that everything can be changed. So like one of my most favorite sentences is not everybody is going to be a miracle, but everybody can be a miracle because we have the potential for change. So when we understand it, life becomes less sticky. We less grab to things, we less identify. I know it from my own personal experience because I have a tendency to identify, ambition. I come from a educated Jewish family. Success is often determined in the Western culture by the end result. We forget the process. And you see it in Lyme patients where a symptom comes and they identify with it, right? And once we loosen the identity, the symptom can go away. And the infections know it. I mean, if we look at parasitic infections, okay? Everybody in India has infection, as parasitic infections, and they live their life, right? But if we come into an abnormal environment from a physical point of view and we get parasite, it affects us because we are not used to it. It's not part of our picture. So we have a reaction to it. So we need to know how to interact, right? We know so well, Scott, unfortunately, how many people do you know who took antibiotic for a chronic case and got worse because it aggravated other infections, right?
Yeah.
Why? Because it changed the balance. One thing got too strong, the other thing had to react as a survival mechanism. So our relationship with the environment is key, and I think it's really why Lyme disease is such an epidemic. It's top medical schools who would laugh about Lyme disease are now teaching about Lyme in the orientation to medical students.
Wow.
Medical things are changing. I mean, that's one of the two best schools in this country.
Yeah, that's amazing. I think they need to continue to change, but that's
Of
optimistic.
course.
That's fantastic.
Yeah.
Let's talk a little bit about some of the tools that you use in your clinic. So apheresis, for example, maybe you can tell us a little bit about apheresis and how that also plays in with Galectin-3, what the goals of that are, and what are some of the compounds or toxins that are removed or affected by that process.
Right. So my journey with apheresis really started because I came up with the idea of removing Galectin-3 via therapeutic apheresis. So it's a biotech project I've been doing now for over 6 years, very complex. It's a whole different part. And, I published 2 papers with Harvard. I'm dealing with NIH. It's a biotech medical device project. But it got me interested in apheresis. And parallel to this, apheresis became of interest to Lyme patients. So there are different apheretic processes, and it's important to emphasize that therapeutic apheresis is a process by which you take the blood, you separate the cells and the plasma, and you filter certain compounds from the plasma, you put it back, and you return it. It's not replacing the plasma exchange, which is a much harsher treatment. So in this process, what we are doing is we are creating an external filter that is able to take out heavy metals, toxins, biotoxins, oxidized lipids, of course, oxidized glycolipids, VEGF, TGF-beta, for example, we take out 60-70%, some Galectin-3, and you expose the tissue for treatments, for example, in cancer. But I find now that in Lyme patients, the most important thing is its unparalleled detoxification effect. Unparalleled. I mean, you can do chelation no matter how many treatments you do. You can do other treatment and the PK protocol. It's nothing like doing apheresis because you have a device that is doing it for you. And then what we do, which is unique to us, we add other IV treatments that will help to dump the fat-soluble toxins from the tissue into the bloodstream, and then the machine cleans it up, and then towards the end, we nourish the patient. So it really evolved to a place where I can say now, I mean, it's unusual for somebody to feel worse after an apheresis with us, which is not the case when you do a just a size exclusion, like it's done in Europe, where everything under a certain size is being removed, because then some protein is being removed, and it can really weaken the patient. Or a lot of IgG is being removed, for example, in the size exclusion. So you are weakening the immune system. It's not the case. And then into this treatment, and again, because this is a public talk, I don't want to mention, I'm a little bit constricted, but into this treatment, we add another very powerful treatment that are usually standalone treatments, but have a much more power when they are done with therapeutic apheresis, because as we already, for example, let's say we did almost 1 plasma volume, you have blood that has less oxidized lipids and 70% less oxidized lipid, let's say, or 60%. The last time we were there, we may have been 18 years old, So the blood is much cleaner. Now the agent that you introduce are much more powerful. So I use it in preparation for strong treatments, but also after. So if somebody had a strong antimicrobial or a strong microbial killing protocol, either oral or IV or et cetera, then there are a lot of byproducts, and it helps clean it up. And I can almost tell now which of the antimicrobial treatments are more effective based on which one is creating more waste material. And I'll tell you this on one-on-one when we talk. It's clear.
Perfect. So if people are interested in doing that kind of a procedure, are you taking new patients at Amitabha Clinic? And so they can just contact your office in Santa Rosa. I'll put the URL in the show notes as well.
Right. Yeah, I can put the URL and the phone number. And we actually now, our interest right now is actually not so much to treat Lyme patients as a whole, but more to be a place where patients and doctors can use our unique services, our specialty. And especially when then they can go back into their doctor and keep doing all the treatments. And it's a trend that it's increasing now, and we get more and more referrals from some of the leading Lyme doctors all over the country. And it's also important to emphasize that it's a good thing to use if you are very sick, but it's a great thing to use if you are not really sick, you're in the middle of, let's say, an antimicrobial or killing protocol, and it's the one thing that can make you really recover or not recover,
How many rounds of apheresis does the average Lyme person need to see some kind of positive shift?
Depends on the patient and depends on the protocol. For some patients, actually very few, 2 to 3 treatments.
Okay, very good. So as we wrap up, what are some of the key things that you do on a daily basis in support of your own health?
So the most important thing that I do, it's part of who I am, is I meditate. So I meditate on a formal level, and I meditate as I'm talking to you. It becomes a part. In Buddhism, we meditate with open eyes, so it becomes part of life. I try to exercise on a regular basis between yoga, qigong, and some aerobic exercises actually. And part of my biggest flaw that I'm doing too many things, and I'm trying to change it, but then I have this big apheresis protocol that suddenly added so much work. So I make sure that I meditate every day, and I try to eat well, although when you travel, it's harder. And I do take supplements regularly. The one thing that I never miss is Modified Citrus Pectin. I take 5 grams a day, and my Galectin-3 went down from 17 to 11, and it's staying there for years. So it's significant, very significant. And my CRP also is very, very low. I take something called mycophyto, which is the same principle like the mycolime, mushrooms that are grown on immune-enhancing anti-infectious herbs. So I just don't get sick, especially for viral infection. I take something for circulation, Circutol with nattokinase and some herbs. And and then of course I experiment. I like to experiment on myself. I think I wish if some doctors would try things on themselves before they give it to their patients. Sometimes it's unbelievable. Oh, take it, it's easy. Well, let's see you taking it, So I definitely try things. But And I still try to carry this habit from the time when I used to do half-day meditation. So I try to formally start working only in the second half of the day. But I must admit, if there's one thing that has changed my life for the worse, it's having a smartphone and internet. Because we no longer have, I used to go for 2 months and just disappear. How can you now? Now you have to check your phone.
Yeah, I know. It's a blessing and a curse for sure.
Exactly.
Well, I'm excited about Mycolyme as well. I think it'll be great to have another tool. I appreciate all of the work that you do. I appreciate the time that you took to share with all of us today in this conversation. It gave me a deeper understanding of modified citrus pectin as well. I know that you and your family have personally been through Lyme and have done very well with the treatment approaches that you put together. And so I just appreciate so much having you as an advocate for people that are dealing with Lyme and for bringing forth so many tools that can potentially be helpful to all of us. So thank you very much, Dr. Elias, for being here today.
Thank you, Scott. Thank you for the opportunity. Take care.
Thank you so much. Talk to you soon. To learn more about today's guest, visit drelias.org. That's dreliaz.org, drelias.org, or ecoNewgenics.com. That's ecoNewgenics.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.